oddly enough, we had not interacted with children. Myself, I'm a family woman. I have children, 4 children. So we're like, we need to do something. My husband and I had a talk where we said, you know what? We need to do something very quickly. We just got the kids. We called, actually we hired a cab without us interacting with the kids. We just told them, pack the kids, let the kids go to my mother. As a person living with HIV, that was the beginning of me to now think, this is going to be serious, more than I thought. By the time I know it, I have actually lost my breath living with HIV. First of all, very many people have lost track of their medicine in terms of taking their taking their medicine rightly, because there's something you need to consider right. Should I first heal COVID? Should
I first fight COVID, then HIV?
So you keep on balancing the two and you get confused. But at the end of the day, you have to make sure your life has to come back to life. So one of them has been that area, the psychosocial part, has been the biggest effect. That people living with HIV have been psychologically, emotionally been affected. Then when it comes to the financial bit of it, people living with HIV have been affected so much. Personally, I have got very many cases of people calling me for food because they lost their jobs, They lost their jobs. Some people actually called me to ask for jobs. Me now, I have turned to becoming just a freelancer where whenever I get an opportunity, I can already work, a consultancy and all that. People lost their jobs. People lost opportunities to even have food on their tables. Those who were in marriages, the gender-based violence actually increased. When we talk about COVID, for people living with HIV, it has been even, a massive thing that, that needs to be followed up. Because remember, there was a time we were on lockdown.
Yes.
People would not actually go to pick their medicines. I am very grateful to the activists and the advocates who stood and said, no, people need to go and pick their medicines until they said, okay, fine, if someone has evidence that is going to pick their medicine. But honestly, when it comes to someone's life, sometimes the stigma is still high. You cannot tell people to show their cards so that they can pass. You will find people actually trying to hide from that reality. So the effects of COVID towards people living with HIV has been massive, has been very big. That when we start to talk about it, we can even just spend the whole program talking about that. But basically, it has been so much of psychological, emotional, financial, and also physical for those who have actually experienced violence in terms of either gender-based violence or even violence to themselves. Some people have actually had violence for themselves, like they have hit themselves. The pain is too much.
Wow.
Yes.
If we are to talk about, you mentioned taking drugs, what are the effects of poor adherence to antiretroviral therapy?
As a person living with HIV, one of the things I know that have been a very big problem as the effects of not taking your drugs either well. First of all, I love giving experience on myself. I was taking my medicines well, but I failed.
Why? When you failed?
Yeah, I failed on first line.
Okay.
Failed on first line. And then I was switched to second line. Not because I was not adhering, but the medicine I was taking for first line was not working on me. By the time they realized...
When you say first line, what do you mean?
Yeah, so there's always first line, which is like given as the start for you to manage the virus within your body. So by the time there's a time you reach and the medicines continue to work with you with that first line. But you reach a point and the medicines, the first line doesn't work for you, and you need to be switched to the second line. For various reasons, either you've not been adhering well, or you are adhering well, but there's something like the drugs that you are taking were not working for you. So you switched. You switch to second line. If you failed on second line, there's third line, but that it comes, with guidelines from the ministry to be switched to the third line, which is not easy. So the question you asked when I go back to the what are some of the things that happen to you when you're not adhering well, is first of all, the drugs become resistant to you. Like you start failing. That even when you try and take your medicines, cause or the biggest effect is always failing on the treatment. Like even when they give you to recover, you need further guidance, further treatment to be able to recover from that.
Wow.
The other one is you find yourself losing weight, then you've moved away from what is called HIV to what very many people call AIDS or slim. You'll see that people living with HIV have their fellow buddies, like you have peer buddies. Now these ones are positive buddies who have actually supported their fellow, people living with HIV at the facilities. Even on addition of that, we have the forums. We have the national forum, the different forums in the districts, the district forums, which are actually led by people living with HIV. And these forums are helpful in a way that people living with HIV, if they don't know where to access their treatment, you can always go to the forum and get to know where to access the medicines. And these forums actually work with the health centers that are within the districts. So for me to just summarize the question, the answer is just simple. There's been a chain of different, people, individuals, organizations that have worked to ensure that there is accessibility to the ARVs, inclusive of the Ministry of Health. So as a person living with HIV, I want to applaud them for that. And also I want to say to the people living with HIV who have become like agents to their fellow people living with HIV, that work should not stop. Because I think if we didn't do that, I think very many people would be dying in silence because of the stigma issues that are around the country, both the self and stigma by others. Yeah.
Speaking of those organizations or those partners, which partners are those that are supporting people living with HIV to ensure uninterrupted access to ARVs?
The first one, of course, is the Global Fund. The Global Fund, everyone knows about it. It is one of the biggest funds. Then we have USAID. USAID has been the biggest friend, partner, donor, to ensuring that people living with HIV have ARVs. Of course, with the CDC, the UKAID, the Dutch, the different partners that have really supported this to ensure that people living with HIV have ARVs. There have not been individual efforts. When someone who actually, I know of my colleagues who would come here and tell you the journey of how it was a problem to get ARVs and the journey they had to take to ensure that they now have ARVs. Some of them would be sending the ARVs from abroad. Their friends who were abroad would actually pack for them the medicine and ship it. By the time it reaches, it's like after a month. That was the chaos that was happening in the country. But really, we thank the partners who have stood with the people living with HIV in the country. And right now, people living with HIV have access to medicines, have ARVs. And now, because people were dying after failing on second line, there's now third line, which is actually after guidance from the ministry or different partners that are working. But the biggest funder is Global Fund and USAID, and then CDC, yeah.
Okay.
Yeah.
Are people with HIV at an increased rate of being infected with COVID-19?
Everyone is at risk of getting COVID.
Yeah, at this rate, at this rate, yes.
Yeah. So I wouldn't want to just say it to people living with HIV. I think let's leave it like everyone is at risk of getting COVID, because my husband is HIV negative.
Oh.
Yes, but he got COVID. So you can't say it's me who infected him.
Yes,
So
yes.
yeah. So the truth of the matter is, when it comes to the COVID, let's not personalize it to people living with HIV, people with disability. Just that the surroundings, why it becomes more vulnerable to a person living with HIV, that when it finds her or him with another virus, it weakens their immune. Because remember, these are now, you have that virus which is actually fighting to have
two
your
viruses
immune.
in your body.
So when it finds another virus in there, that's how it becomes, more dangerous. But every one of us, regardless of your status, you are at the verge or you are at the risk of getting COVID. Just like I said, the difference comes in with the fact that because you have another virus, and when this comes in, you're now fighting two viruses in your body, which makes you vulnerable. You get, because now like I told you in my story, I was fighting two viruses. I have to take my ARVs, I have to take the COVID drugs, which is which. I had to balance. Nowadays, like people say, I had to balance the bots. So, yes, just the fact is, everyone is at risk. The fact, just that for us, why it becomes more dangerous is the surrounding, or the fact that there's another virus it finds in the body.
Wow.
Yes.
How can people living with HIV/AIDS protect themselves from COVID-19? We want to shine more light on them.
Yeah. Like everyone is protecting themselves. I am putting on a mask.
Yes.
I don't have COVID, but I feel I have to be responsible to put on a mask. Sometime, I think, I'll just give an example. On Thursday, I think one of those days, I passed by some hospital to go and check on a lady. It's in my area, and I was the only one putting on the mask. I saw people looking at me like I was a crazy person. I was like, why are people looking at me? I even saw people looking at me as like, oh. Then they spoke in Luganda, thinking I don't know Luganda. Why is she putting on a mask? She thinks that we have COVID. You can imagine how people think like that. So to go back to what you asked is, how can we protect ourselves as people living with HIV? Do the things that they're telling you to do. Put on a mask. When you put on a mask, I got used to the mask because of what I went through. It was now a must for me. I don't care what other people are going to talk about me. But what I know is that I'm protecting myself and I'm protecting the rest of you who are close to me. Put on your mask. I walk with my sanitizer 24/7. I have tried as much as possible to isolate, to give the social distancing and all that. The other thing is having healthy meals. People think having healthy meals is buying meat, buying the things that you go and then start buying the things you think are healthy. Me, I always tell people at home I eat my normal food. I eat my mukene, and I'm so proud.
Very nutritious.
I'm so proud to say it. I eat my mukene, I eat my greens without any problem. Like, eating healthy food is part of healthy living. As a person living with HIV, for you to avoid more other diseases that may come to you, is try to eat healthy, stay healthy, give yourself a peace of mind. I know with the virus, it's not easy. With people, very many people lost their jobs. It's not easy. I can't tell how people, what I just know is that I know what it means when you don't have a job. That job was like your breadwinner. It was like the one bringing to you, working out for you. So, but one thing I'm sure, I assure people of is that you need to learn to be innovative in your own way, to be able to sustain yourself, in the community. Within the communities we live, we have people who love us that we don't even know. When we talk about the people who love us, you may get shocked to find out that this person liked you and you didn't know that that person liked you. So the most important thing for us to do is you need to follow the
SOPs.
The SOPs that have been put. As a person living with HIV, don't feel special. Like, oh, I am HIV. Eat well with your greens. Keep healthy. Keep healthy. I keep healthy. I don't have much money, but I've learned to give myself that peace of mind as a person living with HIV. I don't want to stress myself.
Peace of mind is very key, your mental state.
My mental status is key. I try as much as possible to avoid myself to anything that may stress me out.
Okay, Jacqueline, let's go for a short break and we come back and we continue with Pi mwara Pierre Rio wabere kagunye dwan ma meet I radio dwan ma meet I airwaves ma megwa and dwan eno bere dwan pala tienwa ma walonye ni James Onan eno Paul Padano duonye ni Fat Boy chingcha biet in aleguni po ken en I yupwa makiloni ngej kingene kan I One Luo TV cha bumwen mo tiano KK Star Times ibinowa I channel 547 KTK dish KTK decoder quantity guluki Kampala wati channel 239.
My parents got a lot of criticism. By the way, it's been a big bone of contention in my family, and they were shamed all the time by relatives. But your children can't even speak the language. What's wrong with you? And they'd be there, yeah. And to be honest, I don't know why. We were never taught the language.
Both your language, your parents speak the language?
Yes. Well, my mother is Langi, but literally the same language. So at home, I would hear them speaking in the language as I was watching my Japanese cartoons and enjoying.
Peking a Fat Boy chingcha bietman cha bongwen mo tiano kan kekan I One Luo TV.
One Luo TV, ena ye TV channel chel I Uganda meluo, mau kwa chere satellite, kunene Uganda kiwi lobolo, mantie I Star Times channel dish, a beach angwen abiro. Kai guluki Kampala, nen I Star Times decoder channel, ariyo, a dek abungwen. Peke nyetki galuwa, maaki kumalume Uganda, I One Luo TV, Star Times dish channel beach angwen abiro, pingech matut gono wachimi number, not a dek achelario, a dek abiro, not, One Luo TV. Ngechmati Kigaluwan.
Afo ritual me dugu ki yue manok enron tin wat ichabi chel makudiko man wati iuni wati ki welu magen kiti aki dul makiloni National Forum of People Living with HIV Networks Uganda nyokiloni na fofanu gen kiti tieto etwa ngoma kiramo konyo dan magti kitu jonyo no kirale moro kero ni people living with HIV wirina makiloni ni Jacqueline Alesiti tieto iwane ien meti kitu jonyo no HIV wo furama mete ikarman me COVID-19 mirene monyo yarni mirene e ro maski umi mirene be sanitizing chi en ma pera tekane mirene gwa ka mete ki monyo ya
living with HIV. So any person living with HIV, you are still a person. That means you have a right to any service that may come in the country. We all know that when COVID came, it didn't at one moment, at one time, say, oh, these are people living with HIV, these are people living with disability, these are people living with cancer, these are people, it didn't discriminate when it came. When it came, that means it's attacking everyone. So people living with HIV, I encourage you to go for your vaccine. Wow. Don't feel special, sorry to say it, but don't feel special that the virus is for other people. This virus came for everyone. So as a person living with HIV, please go for a vaccine.
Jacqueline, how will the COVID-19 affect the HIV response, or has it affected already?
Yes, it has actually led to very many cuts in the budgets globally, not only in the country. So most of the monies, the donors have actually channel their money, in that line of COVID, fighting COVID. So financially, it has affected organizations that are working for people living with HIV because there's been a reduction in funding for HIV organizations, which has led to very many people lose their jobs. In terms of the response, in terms of any other thing, you see, at first we used to tell people, right now we are still telling people to go and test for HIV. Right now, you will see that most of the time, everyone, like for example, when we were in lockdown, it was about COVID.
Yeah, no one.
But remember, there were outside there were people getting infected.
Oh yes.
So we felt, personally, I would give an example. I felt so touched that very many people during lockdown actually got infected, but the services, accessibility to services, especially the first lockdown, was a problem, whereby people could not go and test. Remember, you will not touch on anyone. I love the fact that they have brought self-testing, but not everyone knows how to use it. So we felt that was an effect that actually really, really affected the response, because very many people got infected, but the testing rate was low. Very many positive women gave birth, but the babies were not tested. We're not
Creating psychosocial support and reducing stigma among people living with HIV during the post-COVID-19 pandemic.
Like I said, when it comes to HIV, the psychosocial got when I openly came out that I am HIV positive. I was embraced when I told people I had HIV. I was loved. But when I told people I had COVID, I had a lot of people discriminating me. I had a lot of discrimination. The only people who stayed with me were my family. My mother, who actually almost wanted to come, but she's old. I told her, don't risk, you are, my husband were the one. But when it came to the outside people, everyone who would know that I had contracted COVID, they would be like, oh, no, I'm not coming. I'm not coming. So the stigma that I experienced when I got COVID is worse than the experience I got when I shared that I was HIV positive. So when we talk about the psychosocial support related to stigma, we need to really learn to address both of them differently. Stigma is stigma. Whether it is stigma of HIV, of COVID, or cancer, or disability, we need to know that when someone is stigmatized, it is stigma. If I came here and you told me, oh, you're sitting near me, please, since you have HIV, and moreover you go to COVID, extend that side, go sit the other side. As a person who is, I would say, who is educated, or even who knows my rights, I'll just leave the studio. But one thing we need to learn to do is embrace the realities that within the people we live within, there are those who are HIV positive, there are those who have lived with COVID, there are those who have lived with other diseases, but they fear to come out because they fear to be discriminated or rejected or whatever it is. So we need to learn to show empathy. We need to know that today is me, tomorrow is someone else. We have our champion, our hero, as people living with HIV, Fire Bongole Rutaya, who actually sang, today is me, tomorrow is someone else. Where we see that I am the person living with HIV today, tomorrow it might be one of you. Each one of us, let me make this before I forget it. Each one of us in this world, okay, let me give a very short description. Each one of us in this country or in that district you're coming from is affected by HIV. Is affected. You are affected. I am infected and affected. Every one of us here is affected because you either have a friend, you have a sister, you have a sibling, you have, who is HIV positive. That makes you as someone who is affected. So each one of us needs to know that today is me, tomorrow is someone else. Today you might reject me, stigmatize me, but tomorrow it might be your turn. So before you learn to stigmatize, before you stigmatize other people, learn that it might be tomorrow. You might be the one who is stigmatized. So let's learn to support one another. Psychosocial is, let's also make sure that we support the expert clients in terms of, for example, right now, we really want to, I totally forgot to thank UNAIDS. UNAIDS is one of those partners who has stood with the people living with HIV. The UNAIDS is the Joint AIDS Program. It's the UN program that is actually supporting some of these programs that we are having on the radio, where we're supposed to come and tell people that, COVID and HIV are different but the same, because by the time you know it, you're experiencing the same rejection symptoms, even worse. Someone who has COVID, like I was telling you, the rejection or the stigma I experienced when I told people I had COVID was worse than when I told people I had HIV. So to me, I feel we need to fight those two. We need to fight the stigma. We need to make sure that we support people to fight the stigma, because stigma is one of the killer diseases. Stigma is one of the killer diseases. You'll find out that most of the people who actually went and died in silence feared to be rejected, feared to be stigmatized. They said, oh, let me just go and sit in my home and be okay.
Wow. What advice do you give to people who are worried that they have been exposed to HIV during COVID-19 outbreak, and people living with HIV who fear contracting COVID-19?
I don't think it would be even advice. I would want to just tell people, know that, when the world, today is COVID, we are in the COVID. There's a time we are in Ebola. You remember?
Yes.
There's a time we are in which other pandemic that came?
Epidemic. We've had a few small ones like polio.
Polio, yeah. But okay, let's give an example of Ebola. When Ebola came, everyone was taught to do different things. Even we reached a point where you would travel in a country and say, you need to be, these countries are taken as high risk. I went to Mexico one time and I was like, you come from a country where we were told there's been a lot of, and cholera actually. So we were put aside. All the Ugandans who went for that conference were put aside, like to be first tested. I was like, this is like some years back, but the record stated that Uganda, there was cholera and Ebola.
Yes.
So it's the same thing. We're going to reach a point where you're not going to be asked about your status as HIV status, but you're going to be asked about your in line with you're going to be asked a question around have you had COVID before? Then you'll be like, oh no, I don't know. Have you been vaccinated before? No, yes, no, yes. Those are the questions that we are expecting in the near future. So my advice, like you said, what should be my advice? My advice is I kindly ask people know that COVID came, there has been HIV. They should not put one aside and say, okay, let me first prioritize COVID and put my HIV aside. By the time you put your HIV aside and concentrate on COVID, one of it has taken you.
Yes.
So you have to learn to embrace both of them, learn to protect yourself. For those of those people who may have contracted HIV during COVID, my advice is that don't fear, come to health facilities, the nearest facility you might be fearing to go to the nearest facility. You can call someone who you know in the HIV work, and they will direct you to the nearest, like somewhere where you can go and access ARVs. But please know that you still have the time. The only problem that will come when you want to go and access treatment and it's late. I always tell people we are lucky that the medicines are there and are for free. But I'm not lucky that, I have the virus, because there's some things I always tell people, and I've told the young people, if you have not contracted HIV, please protect yourself, or please make sure that you still go back to your ways of becoming I don't want to use the word of becoming good, because some of us contracted it not because we are bad.
Because you are bad or you are misbehaving.
You are misbehaving. But the moment you see that
pay all ki pay all ki roko mask, pay all ki sanitizing ni chi antibiotic iwani poor food rama mete ke HIV from karman me COVID-19. I was just interpreting.
That's okay.
And as we conclude, what can people want guidance and counseling? Where can they reach you and how?
First of all, the easiest or the nearest person for counseling, wherever our viewers are, is the nearest person, is the forum of people living with HIV. For example, I know this TV station is covering areas of Lera, Gulu,
and then the northern regional LUO, Pakwash.
Yes. So all this TV is reaching, and each of those places there is a forum of people living with HIV. There is a district forum of people living with HIV. So maybe what I will just do is I'll ask someone from Nafufano to give you the contacts of those forums, so that's in those places, and then get in touch with them. For those of you who would want to reach out to me as a person for counseling, please don't call me to say
other things.
Other things.
Yes.
I've got a challenge that sometimes when I give out the number, people start calling to say other things. So please, the respect should be given to the phone, and it should be called strictly for counseling. And I'm so happy for those who have actually called and they have asked for counseling. This counseling should not only be limited to HIV. I also do say that because I'm a psychologist. Okay. So I do a lot of counseling that is actually beyond counseling, and gender-based violence. Those who have had issues with relationships and all that. I do marriage counseling and all that. So my number is 0702 597384.
Jacqueline, before you go, I want us to talk about something like mental one, because mental health, especially in this COVID-19 times.
By the way, there are a lot of myths that are surrounded around COVID. There are facts and there are myths. There are those which are not true. So you'll find yourself that the myths or the untrue ones are actually taken serious more than the truth ones. Yeah? People take the myths so serious. So you find yourself mentally disturbed, like, oh, why would people really reject me? Even, by the way, you reach a point and the signs stay with you. For example, there's a time...
You alienate yourself from the crowds.
Yeah, you find yourself trying as much as possible to isolate yourself. But also those signs that you got, like the nausea, they keep coming. They keep coming every time. They keep coming, and then you're like, oh, maybe I still have COVID.
Oh, I also got COVID once though. I got COVID and I healed. But after like 2 weeks or something, I would still get like flashes.
Exactly.
Flashes of a small body ache, a small nausea.
So those things mentally can disturb you. Like you're like, how long is this going to take? You're not sure when this will end. Unlike HIV, like when you start taking your medicines well, your life goes on. Like you do things normally. With COVID, there's a way you feel like, I don't need to do this. Wow. You're supposed to, you feel like know that COVID can get you. Just make sure you do the right things. Follow the SOPs. Go vaccinate yourself if you can, and also make sure that you protect the people around you if you have COVID, if you've got it. The first thing that has to come to your mind when you've been told or if you've realized signs, protect the people around you.
Wow. Thank you very much, Jacqueline Alesi. America Loki Mego Jacqueline Alesi, ma anti-HIV activist, Krale Moro Kero Kere, Titier Irwango, Madano Matiki to Jonyo HIV, Kiramir go bed kere, and Ramapia Tiako Berka Locum stigma, Loc Madme.
LUO TV ngej matiki galwang European
tie namba chiel ki komalame Uganda
ma iroding ento weye la yap it wan wa goy we ma monya do we ma queen
let's make a boom party for me
kanje ken
kabakuru okumanya